The Theology, Medicine, and Culture Initiative at Duke Divinity School welcomes you to our lecture series entitled Jesus and Medicine. What does Christianity have to offer healthcare?
I'm a philosopher working in applied bioethics and a theologian who draws broadly from Christian tradition. I've been shaped by an African American Christian experience that is deeply rooted in biblically informed democratic values. It has always had to take seriously the work of public theology. It continually asks, among other important questions, what does love look like in public? And further, from my own work, what might these resources mean for the area of bioethics? With respect to my work in bioethics, I began by serving as the director of the ethics department for a hospice care center. I was struck by my encounters with healthcare that used medical technologies in a way that prolonged the process of dying, seemingly as an attempt to save a dying patient from death itself. Though, of course, no one would say such a thing. My work in these clinical spaces prompted me to ask, what might it mean to uphold the dignity of patients, their close loved ones, and the staff involved in their care? Paul Ramsey, who is a Christian ethicist working at the intersection of religion and what I'm calling bioethics, reminds us that life is a gift and a trust given to people by God. Now, this has significant meaning for the kinds of decisions and dispositions we should have as we approach life's end. We need to think deeply and carefully about what does it mean to value life at the end of life. These are certainly important matters. As I started wrestling with these issues, and as I was working with groups and communities who were either poor and socially disenfranchised for various reasons, it became increasingly difficult, if not impossible, to talk about what it means to value life at the end of life for those who are on the margins without asking the question, what does it mean to value life before the end of life? It is sobering when we think about the alarming statistics around the claim that a significant indicator of health outcomes is based on zip codes. It is sobering to recognize the deep health and healthcare disparities and increased incidence of mortality that exists between communities divided along racial and socioeconomic lines. It is sobering when we remind ourselves that behind these stark, impersonal statistics are very real people in very real communities to whom those of us working in these areas have very real responsibilities. I think we need a concept of human flourishing that makes clear how health and disparities of health are implicated in human flourishing that can help us identify what makes a health inequality in fact an injustice. I'm convinced that this can be captured by the concept of shalom. Now, shalom is a multifaceted idea. It reflects a reality marked by the presence of physical, material, and spiritual well-being, personal integrity, justice with respect to human relationships, institutional life, the natural and non-human animal world, and to God. The concept provides theologically informed moral vision to which work in our vocations should aspire. This vision is motivated by the Christian idea of agape love, or neighborly love, which seeks to promote shalom. The meaning of agape is a love of neighbor for her or his own sake. It seeks to uncover or identify the neighbor in people we meet, having deep regard and concern for them. An important feature of agape is its role in the creation and preservation of community where there previously was none. Dr. Martin Luther King Jr. was a staunch proponent of this kind of love. Before his speech to the Medical Committee for Human Rights during a 1966 press conference, King stated, "Of all the forms of inequality, injustice in health is the most shocking and the most inhuman because it often results in physical death." King's understanding of love, his commitment to the idea of a beloved community, and his work towards this goal was deeply informed by a vision of universal agape that calls us to be responsible for each other. Furthermore, this vision of shalom is grounded in a portrait of Jesus Christ that emphasizes the importance of human beings as being social and embodied. Biblical tradition affirms that Jesus is the image of God. And from this, some strands of Christian tradition have affirmed a Christological approach to understanding people as being made according to or in the image of God. There is then a corresponding value imputed to people on this basis. If God takes on flesh, that puts a particular emphasis on the embodied nature of people, the social nature of our humanity, to which we need to be attentive in order to affirm human dignity and promote human flourishing. Jesus used parables as tools for challenging assumptions that people often take for granted about the world. They expand our understanding of what love, compassion, and justice require and how these relate to the Christian notion of grace. Jesus used parables as a way of offering a radically different way of conceiving reality, as Christopher Marshall would say. The parable of the Good Samaritan is a case in point. Jesus provides a parable to respond to a lawyer's question concerning who are his neighbors. This parable not only challenges his thinking about what a compassionate and just love of neighbor requires, it also gives a far more expansive understanding of who our neighbors are. This parable informs us that the consequences of love are far deeper than we ever could have imagined on our own. What might it mean for healthcare professionals to embody the kind of love of neighbor described in this parable? Might this parable expand our moral imaginations in wrestling with such important matters? I think so. I want to suggest 3 areas of development that can inform how we are to embody love of neighbor. First, we need the eyes and maybe even the ears of the Samaritan. He was proximate in a way that he could see others as persons and affirm their dignity. Proximity breeds empathy. Distance breeds apathy. Perhaps we have not been close enough to each other to appreciate the particularities of our embodied humanity or to recognize one another's plight. Nor in some cases are we close enough to hear the cries of those despairing from disparities in healthcare. We need to have eyes to see that many instances of racism and its undermining of human dignity in our contemporary contexts are of a systematic nature that disintegrate our human communities. We need to see how this is expressed in our policies and social practices that are often distinct from the individuals who engage in them. Second, we need the heart of the Samaritan. We need to cultivate the kind of compassion that is informed by the gospel. Our hearts need to be filled with compassion when we encounter affronts to human dignity. The Samaritan saw and had compassion. It is compassion that moves us to see the situation in the parable the way Dr. Martin Luther King Jr. observed in his last speech the night before his assassination when he said, and so the first question that the priest asked, the first question that the Levite asked was, if I stop to help this man, what will happen to me? But then the Good Samaritan came by and he reversed the question. If I do not stop to help this man, what will happen to him? Compassion arises in our hearts when we enter into spaces of suffering, not when we seek to avoid them. Compassion is a gut-wrenching response to human suffering and anguish that propels one to act beyond the limits of what is considered reasonable and acceptable. Further, compassionate justice compels us to ask broader questions about the Jericho Road. While it is a good thing to have Good Samaritans, it is also important that we ask the question and seek answers to the questions, why is there so much happening on the Jericho Road? And can we do something collectively to minimize the number of incidents that creates the need for the kind of deep, extraordinary love that this parable requires? Third, we need to have the Samaritan's hands and feet. The outward expression of compassion is understood in terms of extending mercy in the form of concrete actions. The Samaritan intervened in a manner that interrupted the trajectory of hardship of another. He dedicated his time. He dedicated his attention to the recovery of the other. Moreover, the Samaritan used his position and his own resources to work towards eliminating other potential barriers that could be sources of further exclusion and marginalization. Again, to quote Martin Luther King Jr., we are caught in an inescapable network of mutuality. We live in a shared world house, as indicated in the title of the last chapter of his book, Where Do We Go From Here? Chaos or Community? In some ways, this is our question, isn't it? Where do we go from here? I am convinced that the gospel might help us reimagine our collective work together. Yes, it will be hard work, and many times it will be uncomfortable work, but it is our work nonetheless. As a very young kid, I remember when a family friend, Mr. T, not to be confused with the 1980s, I pity the fool, Mr. T, built a storage unit in our backyard during the scorching heat of an Alabama summer. He allowed me to help periodically by bringing nails and small pieces of wood. As the guy with whom he was working took a break by sitting under a large pecan tree, he told me to go get him before he got shade poisoning. I did as I was instructed, but I could not shake the deep grip of concern I had about this thing called shade poisoning, wondering if I had it, and if I did, how might I get rid of it, since I too had spent a lot of time under that tree. I finally mustered up the courage to ask Mr. T, what was shade poisoning? He looked at me, put his hand on my shoulder, and said, "Son, shade poisoning ain't nothing but laziness. But don't you worry about that. Come on, we have work to do." Mr. T's words still resonate with me after all of these years. Perhaps they can resonate with you too. There is much work to be done in the world of bioethics. May it not be said of us that we suffer from shade poisoning in our collective work together towards a beloved community.
For reflection questions and other resources, visit tmc.divinity.duke.edu/JesusAndMedicine.